All right, today we're going to demystify a procedure that pretty much all of us have been through, the nasal examination. We're going to break down exactly what your doctor is doing, what they're looking for, and why they're doing it, step by step. So let's dive right in. I mean, it's a fair question, isn't it? You're sitting there, head tilted back, this super bright light shining up your nostrils. Is the doctor just looking for a cold, or is there something more going on? Well, it turns out your nose holds a ton of information, and today we're going to go on a little guided tour. You know, before the exam even really starts, a good doctor is already setting the stage. Getting the preparation right is actually the first step, and it's absolutely crucial for making the whole thing go smoothly for both of you. First things first, positioning. It's amazing how a tiny adjustment can make a huge difference. For the external part of the exam, you'll be asked to extend your neck just a little bit. But for the internal part, relaxing your neck is the key to keeping you stable and comfortable. It's a simple tweak that gives the doctor a much clearer view. And of course, you can't see much without a good light source, right? That's where the trusty headlamp comes in. It provides this bright, focused beam of light, and just as importantly, it frees up the doctor's hands to do the exam. So with the lighting and positioning all set, the real exam can begin. Okay, so the scene is set and the hands-on part begins. But here's a surprise. It doesn't start inside the nose, not yet. A proper examination always starts with a careful look at the outside of your nose and your face. The first step is a gentle touch called palpation, which is really just the medical term for using your hands to examine the body. The doctor will carefully feel the structure of your nose, checking out the bones and the cartilage, looking for any kind of asymmetry, swelling, or tenderness. And they're not just touching random spots. They're focusing on very specific areas. They'll gently press on your frontal sinuses, which are right there above your eyebrows, and then on your maxillary sinuses in your cheeks. If you feel any tenderness there, that's a classic clue that could point towards something like inflammation or a sinus infection. And now for the main event, the internal examination. This is where we get a direct look inside your nasal cavity using a procedure called anterior rhinoscopy. It sounds fancy, but it literally just means looking into the front part of the nose. Let's see how it's done. So meet the star of the show, nasal speculum. I know, it can look a little intimidating, but its job is actually super simple. It's designed to gently hold the nostril open so the doctor can get a clear, unobstructed view inside. Sometimes they'll also use an otoscope, you know, the thing they use to look in your ears, with a slightly wider tip. Now, the technique here is everything. A skilled doctor follows these 3 steps. They handle the speculum correctly for perfect control, they use their other hand to gently stabilize your head, and then, and this is the most important part, they insert the speculum while it's closed and only open it vertically once it's inside. That specific motion is what avoids poking the sensitive wall in the middle of your nose and keeps it comfortable for you. And once we're in, this is the view. It's like a whole new world in there. Let's do a quick tour. That entrance area is the vestibule. The wall dividing the 2 sides is the nasal septum. That moist pink lining covering everything is the nasal mucosa. And those curved, bony ridges, those are the turbinates, and their job is to help warm and filter the air you breathe. Pretty cool, huh? Okay, now this is where observation turns directly into diagnosis. Just look at the difference here. On the left, you see a healthy, nice pink nasal lining, but look at the right. The lining, or mucosa, is pale, it's swollen, and it has this boggy look to it. That single visual clue is a dead giveaway, a classic sign of something like allergic rhinitis. And here it is, the key takeaway. You can think of this as a clinical pearl. This one observation, just the color and the texture of that nasal lining, is often the key piece of evidence that points the doctor straight to a diagnosis. It's a perfect example of how much you can learn from a simple visual check. But the exam isn't just about what the nose looks like, it's also about how it works. So after that visual inspection, the next step is often to test one of its most important functions, your sense of smell, which is also known as olfaction. The process for this is really simple but very systematic. You'll close your eyes, you'll block one nostril with your finger, and then you'll sniff a familiar, non-irritating scent, like coffee or maybe vanilla. By asking you to identify it, the doctor is testing the function of your olfactory nerve. Then, of course, they'll repeat the whole thing on the other side to make sure both are working well. Now, a really thorough exam never ends just at the nose. Because your nose is so connected to all these other systems in your head and neck, a good clinician is always going to look at the bigger picture. They're trying to connect all the dots. So this includes checking your eyes, making sure their movement is synchronized, and checking reflexes. They'll also assess a couple of key cranial nerves. For instance, they'll test the trigeminal nerve by checking the sensation on your face, and the facial nerve by asking you to do something simple, like smile or raise your eyebrows. See? It's all connected. And finally, you might be asked to do something that sounds a little funny. It's called the Valsalva maneuver. You just pinch your nose, close your mouth, and then gently try to exhale. What this does is push air up toward your ears through the eustachian tubes. It's a really quick and clever way to check if those important little tubes are open and working the way they should. So let's just put it all together in one neat checklist. We start with preparation, then we move to the external exam, looking and feeling. Next up is the internal view with the speculum. After that, we do the functional tests, like checking the sense of smell. And finally, we wrap up with those associated checks of the eyes and nerves. This list really shows you just how comprehensive a so-called simple nasal exam truly is. And that brings us to the end of our tour. As we've seen, the nasal exam is so much more than just a quick peek up your nostril. It's really a window into your respiratory health, your nervous system, and even your allergies. It kind of makes you wonder, doesn't it? What other simple, everyday exams hold such